Today's video will talk about pain in the shoulder and pain in the hip due to impingement. Shoulder impingement is usually caused by a lack of space within the shoulder joint. In the normal shoulder here, we have the humerus, which is the bone in the arm, and the shoulder blade, as well as the AC joint, which is one of the joints on top of the shoulder. If we look at the space where impingement is, then we see that this space where this muscle and tendon go through has been reduced. Sometimes this bone right here will rise up in the joint and cause less space, or sometimes the AC joint will have a bone pointing down or arthritis within the joint that's causing less space within this joint. While you move your arm through a regular range of motion, this muscle and tendon tends to get pinched here, and this is what we tend to call impingement of the shoulder. When we talk about hip impingement, we have to look at the structure of the hip. Here we see a normal hip. Here we see what we call a cam lesion. Here we see what we call a pincer lesion, and here we have a mixed lesion. With a cam lesion, if we look at the normal compared to the cam, it means that there's extra bone here on the neck of the femur, which oftentimes is a bump. When you go through a range of motion, that bump will hit up against the bone here, which is the socket of the hip, and cause an impingement. With a pincer lesion, the extra bone is actually on the socket, so on the hip and ilium side instead of on the femur side. So again, when you go into that range of motion, bring that hip up, it's going to pinch right here because of this extra bone. With the mixed lesion, we have a combination of both the cam lesion as well as the pincer lesion. So both of those extra bony prominences together, when you go through a range of motion, are going to hit on each other and cause impingement, inflammation, as well as pain within the joint.